Hi, it's Erik Paulsen, and welcome to the Correspondence Corner this week. This is your opportunity to ask me questions as a part of a video conversation where I answer your questions each and every week, and allows me to more effectively represent you while I'm in Washington. Started out the week with Veterans Day. Went and spent some time actually at some Minnesota schools in Minnetonka, spending time with our young people who also took the time to thank our veterans, servicemen and women who have served as not only patriots, but heroes for our country. Had a joint economic hearing in Washington this week that talked about the need to fix long-term structural deficits and debt in our country, getting our fiscal house in order, how important that is. We had a lot of questions that came in this week centering around health care. We're going to kick it off right away with a letter I received from Phil in Edina. He joined a chorus of Minnesotans discussing the president's new health care law. He writes, "Dear Representative Paulsen, my wife got a notice that her current individual health insurance has been canceled. The new health plan forces her now to have maternity coverage and pediatric dental coverage. She's 64 years old and we have no children under 28. It also forces coverage for drug and alcohol rehabilitation, but we don't drink, don't smoke, and we don't do drugs. Her deductible is now doubling also to $6,000. Please repeal this law and replace it with real reforms to help the uninsured and the truly poor. Thanks, Phil." First of all, Phil, you're not alone. Millions of Americans now have either had their health care insurance canceled, they've lost access to their doctor, and they're certainly losing confidence in the president's new health care law. The simple truth is, the law is hurting more people than it's helping. The president committed and made promises time and time again. If you like your health plan, you ought to be able to keep it. I believe that's the case. You should be able to keep your health insurance if it's worked for you and your family. No one should be forced to buy health insurance that isn't right for them individually or for their family needs. And I will continue to sit down at the table with anyone who is willing to work on reforms that will fix some of our health care challenges going forward. I also heard this week from Lauren in Chaska, and Lauren wrote in about an issue that's near and dear to her heart. She says, "Dear Representative Paulsen, as a constituent and someone who cares deeply about the health of our nation's infants, I'm writing to urge you to vote yes on the PREEMIE Reauthorization Act. November is Prematurity Awareness Month. Every day, 1 in 9 infants is born premature in our nation. Preterm delivery can happen to any pregnant woman, and in more than half the cases, the underlying causes are unknown. As a constituent, I ask you to support passage of this bipartisan legislation and help ensure a healthy start for all of America's children. Thanks for your attention to this critical issue." Well, the good news is this week we passed the PREEMIE Act with strong bipartisan support. It reauthorizes federal research programs to better coordinate pediatric care and address the issue that nearly 500,000 babies every year are born prematurely and are at risk of having severe health defects or also some long-term physical disabilities. Thanks to great organizations like the March of Dimes and the families involved in these organizations, we passed this legislation and will continue that advocacy. Thanks for joining this week on the Correspondence Corner. If you have any questions or thoughts yourself, you can always get me on the website at paulsen.house.gov or reach out to me on Facebook and Twitter. Have a good weekend and a great week.